What are the students doing now?
Primarily, they're doing a deep compression to the forearm flexors. It's really good for people with carpal tunnel issues and hand and wrist pain. It's a very deep tissue technique for the forearm flexors, and there's a secondary arterial tourniquet. When they use this, sometimes their tibia is very pointed. They kind of have to turn their leg to the side to get a softer piece of tibialis anterior. Also, I showed them how to use a pillowcase or a towel to kind of dampen the pressure so it's not so sharp. When you use this technique, make sure to warm them up first with your hands just to get a feel for what feels tight and restricted and dense towards the elbow. And you don't want to go into the antecubital space. I think it's what's called right here, the crook of the elbow. And then it's this arm, right?
Yeah.
And then you just have some tenderness, so like some discomfort in here, or?
Yeah, and this side will go a little numb.
On the ulnar side? Okay. No real problems with your hands? Okay.
Yeah, nothing that's like injury yet.
Okay. Lift your head for me. I'm going to replace this underneath. There we go. Is that pressure okay?
Yeah.
And again, not too much? Not too much?
No, it doesn't.
Okay.
What are you doing right now, Robert?
I'm just warming her up and pressing into her forearm flexors. She said she had a little bit of tightness, sometimes discomfort in this hand along the side of her ulna. And I'm just working some of the musculature there. I'm going to use a deeper compression in a minute. I just wanted to warm this up first.
Thank you for your consideration.
Instead of just diving in. So, how many of you have problems with your hands? Me. And welcome to my industry. So, guess who thought they once had a case of carpal tunnel syndrome? Your teacher. And I went to the doctor. I was working at Women's Center for Wellness. It's part of Women's Hospital where I was born. Goes back to my roots. Was born at Women's Hospital. Worked at Women's Hospital in their spa and was basically hurting my hands because they wouldn't let me do Thai. And I went in and they basically said, there's nothing wrong with you. You should probably not work as a massage therapist. All right? So tightness in people's carpals, you can always go in and work the hand. You guys are pretty familiar with these structures. I mean, you can work on yourself, right? A lot of people will have a lot of tightness in this junction between the thumb and the pointer finger. It's a good spot to work. But for a lot of people, your real bread and butter, you can come along and work the flexors. The radius and ulna are side by side. I had her scoot to this side of the table so I had some more mat to work on. On my mat, her hand would still be completely on the mat, right? But I can come in and what I was doing was just using a little palm pressure through here. This section usually of the arm is still really good to work, but it doesn't seem to have as much tension as this top portion. This top portion is thicker. It includes the forearm flexors and a muscle called pronator teres, which turns us into Velociraptor extraordinaire. So if I come in here at the top, I'm not into is it the antecubital space? Is that what they call it? It makes me sound smart at parties. I like that. I'll go into this between the forearm flexors, and then sometimes I'll kind of mobilize just to see. She's not having a lot of tension here, but if they're having problems, usually with pronator teres, I'm supinating their hand, right? I'm opening it up. You're lengthening that while you deliver some compression. How's the compression there?
That's great.
Feels great. Okay. Once you've softened that just a little bit, just because I want to feel with my hands first, I'm going to use a bigger, broader tool. Now, if it's too sharp, I have a pillowcase. Bloop. I, again, don't want to be in the crook of the elbow, but if I come into this dense junction here, how's that there?
Oh, that feels really good.
Okay. Not too much?
It's almost too much, but it feels
Okay.
great.
Right there. How's that?
Great.
Okay. So slowly what I'm going to do is I'm going to mobilize her hand just a little bit on my own. Think pin and stretch, right? So with your hand, the pressure here, not too much? Okay. Can you close your hand into a fist?
Oh, that's too much.
Okay. So just as much as you can, comfortably. I'm going to back off just a hair. Is that better? Now close into a fist. Can you slowly, it's right at your edge, right?
Yeah.
Okay. Then slowly open your hand out. Can you pull your hand back this way? Just to your end range, wherever you can comfortably. And then close into a fist. Kind of an active pin and stretch. It's really hard for her to engage and close her own forearm flexors because I'm already pinning it, right? She has to slide. So let that guy go. Any tingles? Numbness in your hands? Because usually that's pretty normal. And I don't know if you guys can see this. A few of you, if you want to come up just a little bit closer, you don't have to get into the camera view, but I want you to take a look at her hand and tell me if you notice how pale it looks.
Yeah, the whole thumb is wet.
Okay, so very slowly, what I want you to do is I want you to keep your eyes on her hand and her fingers, okay? I'm going to very slowly take pressure off. Keep your eye on her hands and fingers. Now, arterial compression. It's not necessarily what I'm trying to do because I was trying to affect the forearm flexors. Like when you move your hand around now, how does that feel?
Feels great.
Yeah.
Feels way looser. Just like there's no restriction in the forearm.
How difficult was it on my hands? Now, the secondary part, when I let go, what did you feel?
Oh, it's great. It's like a rush of warmth and like nerve healing and everything.
And I am quite nervous that your state regulatory board will make that illegal. Because they will say, no, you can't. And I'm like, can't what? Manipulate soft tissue? Make sense? So when you do Swedish, and let's say I was doing Swedish on her leg, does it have an effect on blood supply?
Yes.
But you wouldn't come in and put direct pressure on her femoral artery, would you?
If it wasn't gonna last for a long time and you're doing a pin and stretch, it's basically the same thing. Is it wrong or not?
So here's the thing. If you call it a blood stop, you get into a weird area. How many clients want their blood stopped?
None of them.
Sounds dangerous. When I'm working the forearm flexors, there's a secondary component that happens on its own. As her arm lets go, as the muscles unwind, I'm having an effect on arterial structures. It's a secondary component. I'm not doing it just because it's a party trick. The reason I do it in that case where I make you watch your hand is to as a visual demonstration. When you have carpal tunnel syndrome and you have inflammation, you have anitis, arthritis, appendicitis, right? What does blood flow do to inflammation? You know any research studies? You know any research studies?
Well, if it brings oxygen
So what I want you to do is ask good questions. I don't tell people, I'm going to do a blood stop. They're very commonly done in Thai massage. They're done on the femoral artery in specific. They also happen on the arms. It's not a party trick. That's a very simple, easy kind of starting point to get going with that, to be able to explain to people, one, we're helping release their forearm flexors in a really great way. Another part that happens is I'm pressing her arm down into the table. Remember when I talked about the pain science community and skin stretching? What happens to her forearm extensors when they're on the table and I'm pushing them in?
They're getting compressed too.
It's their whole arm. It forms a tourniquet. It's an arterial tourniquet in combination with a soft tissue technique. And when I hold it for a while, people, normally I can almost time it sometimes on a mat. I'll wait about a minute and I go, are you getting some tingles or like numbness in your fingers? And they're like, yeah. But listen, they feel much more calm because I knew that was going to happen. And then what I do very slowly is I will step off and it's like a hose. You've crimped it and you go, flush that out. How did it feel?
Felt great.
Felt great. Not harmful, doesn't cause any issues. Do I do it on a lady who just had a stroke?
No.
Some guy who just had a heart attack, he's on blood pressure medication. Exactly, just common sense. When you hear blood stop, don't get afraid. They're just things that are used in Thai massage very commonly. When the compressions get bigger and broader, you're using your legs, your feet, your tuchus, you're sitting on people. Those happen just naturally along their limbs specifically. Okay?
So probably if people have embolisms, easier chance of having embolism. If they ever said that, you probably would never want to do that on them, correct?
Common sense. Yeah. Do you guys want to try that? Okay. You can use the pillowcase to dampen. Sometimes you can do it without. There's a difference when you use your knee and using this, ow, and then using like this. This is a bigger, broader structure, right? Like, in other words, when I did that, it wasn't sharp. Yeah. And I use this to dampen just a little bit as well, because sometimes this can be a little bit pointy along the tibia. I want you guys to try that. Thank you for letting me. So you see how pale her hand has gotten?
Yes.
So just let your hand relax. And then what happens if you just lightly wiggle your fingers? Where did your hand want to go?
Not very far.
Not very far. Is it too much here?
Sometimes when you're doing Thai massage, it's like they're paying me to sit
And then
on
very
them.
slowly just look at her
I guess I
fingers.
should look at
I'm going to start to release.
And whenever you're coming out of this, you want to make sure you're not.
It's like they rehydrate it.
It can be a little bit.
Oh my gosh. It's like numb almost.
Yeah. How does it feel now?
That's a lot easier than isolating.
So the forearm flexors and I'll go over this again. The forearm flexors and extensors are basically pulling across the carpal.
Right.
It almost feels like it's jamming
Yeah.
to this.
Yeah.